Paul Pacelli is talking about it. Connecticut Today with Paul Pacelli, WICC 600.
All right, we will take a couple seconds out here for news at the top of the hour. Latest on the George Floyd case, the upping of charges against the officers involved. Learning now over the past 2 or 3 months, we're getting any closer. All that and more, traffic and weather.
You're listening to Connecticut Today with Paul Pacelli on WICC 600.
And we thank you for stopping in. We appreciate it. Yes, Paul Pacelli here, producer Eric, Paul show around at WICC 600 on the radio and online at WICC600.com. Well, a couple, 3 months into this whole coronavirus thing, where do we stand? Our next guest joined us a couple months back when this whole thing was dawning to give us her perspective on this. She is back to update us on where we may stand or may not stand or how far we stand away from getting a federal okay for a vaccine or vaccines. There may be more than one. Professor of Biology and Virologist Sarah Crawford, Southern Connecticut State University. Professor Paul here. Good to have you back. How are you?
Thank you, Paul. It's a pleasure to be back. I really enjoyed our first conversation back in April, and I got a lot of positive feedback. Lots of people heard it and were informed, and that's really the goal here.
Well, that's great. Thank you. I'm glad I could be of service, and thank you. Well, it's been a couple of months, as you say, and I would imagine for you folks who watch biological agents, who watch viruses, infectious diseases, I'm guessing that it's been just a cascade of information, Professor, almost on a daily basis.
Absolutely. It is a struggle to keep track of everything that's going on. It's, on the one hand, it's a wonderful thing that there's so much research going on, and it's setting a new paradigm for doing research. On the other hand, sometimes haste makes waste, and we don't have the results as accurately as they should be propagated, and there is such a complexity to the situation, obviously from a health perspective and also from a biological perspective and economic and political. So it is a conundrum in so many ways.
I have enough background in people in my immediate family who are involved in this sort of stuff, and in medical reporting over the years, professors. I keep telling people, and I'm sure you tell people this too, that trying to figure this out in 2, 3, 4 months and just hurry up with a vaccine, hurry up. It is such an incredibly compressed time frame. I mean, I don't think your field or people who work in this stuff for a living have ever seen such a demand for this in such a short period of time.
Yes, that's true. I'm currently writing a paper on the COVID-19 epidemic and pandemic and the possible treatments and vaccines. So yes, it becomes an enormous challenge simply to keep up with what's going on. I think the most recent in history comparable situation was HIV/AIDS back in the 80s and 90s. But even there, it can't really compare with the degree of stress and trauma that is facing societies worldwide because of the threat of this virus, which is so transmissible and so complex that going through all the details of the virus and trying to find clues towards prevention and vaccine is really critical, and that's what I'm trying to do.
You mentioned HIV/AIDS and having had people that I know in my family in the bio industry. It's interesting, Professor. We do see people who say, well, there will be a vaccine for COVID-19. But then again, we hear people, I'm sure you do too, who say, well, this might be elusive. It may be just a course of antivirals or different combined therapies if we don't have a straight vaccine. What are your thoughts on that?
Well, I've been thinking about it a lot. I think that it's absolutely true that in addition to an approach towards developing a successful vaccine, we are going to need antivirals. There's a lot of evidence that immunity to the virus may not be long-term. That's really what I'm taking from a number of studies, both on the COVID-19 or SARS-CoV-2, as well as related coronaviruses that have been in the human population for many, many years. So collecting data from all of these studies, I think that the immune response may be somewhat temporary. And therefore, we might see a situation where we would have annual vaccines to keep the immune status healthy in the population, as well as targeted antivirals to delay and prevent the degree of severity of infection in individuals who are exposed to the virus.
So we're looking then, Professor, maybe at kind of the same way we treat and attack the yearly influenza strains.
I think that's a good model. Unfortunately, there's more complexity here in terms of the pathophysiology of the disease. But on the other hand, yes, I think that that is the approach that will probably be most successful.
Tell us a couple of things that have surprised you folks and maybe have generated a complete 180 from the outset when you and I were talking a couple of months ago and said, okay, we're pretty sure of this and this and this about the virus, and maybe a few months down the line, it's, well, wait a minute, that's not really the case now. Are there one or two things that you can highlight there?
Yes, I absolutely. That's a really good question. In studying the pandemic on a daily basis, I think one of the most striking things in terms of the disease itself is that really in a certain population, it's a very, very systemic, highly systemic disease that is not confined to the lungs and that has a lot of systemic effects such as blood clots and other consequences that can be deadly. The other thing that has struck me very seriously and maybe optimistically is that the number of individuals who are exposed to the virus versus the number that actually become ill, that ratio is actually promising. It's estimated that there's no good data, but it's estimated that between 20 and 80%, which is a huge variation there, of individuals who are exposed to the virus may never develop true symptoms. And I think that's a very important key to solving this mystery. I think we need to figure out why is it that some people don't get sick? And I think if we could figure that out, we'd be a long way towards developing therapeutics and perhaps even vaccine approaches that would be successful. And that's a very, very striking result. In addition, looking at countries where, for example, BCG vaccines are given early in life, there is a correlation between those countries and lower incidence of COVID-19. So I think, again, we're very early on in this whole story. And there are a lot of tantalizing clues, and I think we should not be fixated on one single approach. We need to take a global view, so to speak, of what's going on with the virus and how this is affecting individuals. We don't want to just focus on the most serious consequences, but let's look at people who don't get sick. Can we take information from those situations and apply them to treating and preventing infection in other more susceptible groups of people?
Professor Sarah Crawford, a professor of biology and a virologist at Southern Connecticut State University. Professor, hang on. We'll be right back to you. Want to do another segment here, fascinating stuff, as we talk about what we've learned and what we're still learning about the coronavirus.
Thank you.
With Professor Crawford straight ahead. First, traffic and weather together, 316 on WICC.
WICC.
Recent issues in the news that might affect you, featuring attorney Kathleen Nastry.
The tort system in 4 minutes with Professor Sarah Crawford, professor of biology and a virologist at Southern Connecticut State University in New Haven. Professor, since we talked first, I also interviewed a bunch of other people, including a geneticist from the West Coast, who said that there's an interesting look or quandary as to why women are generally faring better against this than men do. And he had postulated regarding studies that show the chromosomal makeup of women actually may pose a more difficult, as it were, lock to pick for the for the virus than for men. Any thoughts on that? Have you looked into or what is the current state of thinking as to men versus women, and why I guess women tend to do better than men on this?
Yes, looking at the demographics, it is clear that particularly in more advanced forms of the disease, men seem to be more vulnerable. I haven't heard of the specific study about the chromosomal vulnerability, but I do know that we're learning more and more that the virus itself is not restricted to infecting the lung, that it does a good job at interfering with the normal functions of the cardiovascular system. And men typically are more at risk, particularly at younger ages, for cardiovascular disease. For a number of reasons, some of which are apparently genetic, women having the protective effects of estrogen premenopausally, and other coincident factors. And that seems to be important in affecting the severity of the disease in men over women because of what we're learning now about the virus, the fact that it has a tremendous effect on the cardiovascular system. And this seems to play a big role in determining the outcome, particularly in more advanced cases. So my vote would be that it is the pre-existing physiological situation that is different in many men from many women that may pose an increased risk of more severe forms of the disorder.
I know there seems to be a small minority of infectious disease people, but there are enough of them out there that I keep reading, Professor, that there are some who say, hey, let's wait because this might go the avenue of SARS and MERS and simply, for lack of a better term, burn out or become almost non-existent for who knows, environmentally, weather-wise. What are your thoughts on that? Is there any shot of that happening?
Well, of course, anything is possible, but realistically, I don't think so. In the studies that have been done on SARS the first time around from China in the early 2000s and MERS, SARS had a higher fatality rate as well as MERS, but neither one was as transmissible. In other words, they weren't as contagious. And I think what we're dealing with here is an issue of contagion more than anything else. It may be that most people who are infected by the virus do not become seriously ill, which is a very positive observation if it holds. But on the other hand, it is highly transmissible, highly contagious. And that's really what distinguishes this virus from the other forms of the coronaviruses that have resulted in epidemics and pandemics, and makes it much more similar to the flu virus, especially in analogy to the worldwide pandemic in 1918. So I believe that that's really the critical difference.
Have we figured out why the virus is so transmissible? Is it its physical makeup? Is it the fact that it is more infective when it is passed from one person or one living being to another? Do we know why it's more transmissible?
Well, we're learning about that. Certainly the virus genome has been sequenced, and we're studying particularly the spike protein on the surface of the virus. And it appears that that protein is extremely efficient at binding to receptors in the nasal cavities and in the throat and in the bronchioles and the lungs. It's very, very efficient. So the infection rate is very high. And that's due to the structure of the protein in the virus that interacts with human cell receptors. And that is a very powerful evolutionary jump for this type of virus to be so transmissible, so infectious, and then so broad spectrum in its effects, because it turns out that the receptor that it binds to is found on many different tissues in the body and has extraordinary consequences in terms of human physiology. At the same time, hyperstimulating the immune system, which makes it very, very difficult for more advanced cases to recover due to collateral damage, and even threatening the development of a long-term vaccine because of the transient nature of the immune response to the virus, and the fact that the virus is so good at taking over the immune system and weaponizing it against the human body.
So those spikes, in a sense, the structure of the virus is almost like having a master key then for a hotel or something.
Absolutely. That's a very good analogy. Perfect analogy, yes.
And finally, in about the minute we have left, I can't let you go without asking you the $100,000 question because you knew it was coming. When are we likely to see, your best guess, doctor, I won't hold you to it, likely to see the feds call a news conference and say, okay, we have a vaccine, we've okayed it, here it comes, first responders and the elderly first. When realistic do you think?
Well, I mean, it depends on what kind of vaccine you're looking for. If you're looking for one that sort of superficially passes all the preliminary tests in a very non-threatening way, in other words, not affecting in a negative way the human body and perhaps providing temporary protection, it's possible that we'll get that by early 2021. If you're talking about a vaccine that provides long-term protection and has been thoroughly clinically validated, I think you're talking 2 or 3 years. Therefore, I think it's going to be really important for everyone who's involved in research to, at the same time as trying to develop vaccine approaches, to develop therapeutic approaches. In fact, right now, there's a new antibody therapy that's being developed that is designed to treat infected individuals with antibodies that will destroy the virus before it can take over the entire immune system and physiology of the body. So these kinds of targeted therapeutics may be very, very important to preventing the more advanced form of the disease, which is really what we need to focus on as we develop new therapeutics and preventive approaches.
Professor, thank you so much for informing my audience of this. It's great stuff. Professor of Biology and a virologist at Southern, Professor Sarah Crawford. Professor, thank you. Be well, and we'll be in touch. Thanks.
Thank you, Paul. You do a great job. Have a great day.
Thank you. I appreciate that. Professor. Thank you. All right. There you go. All right, folks.